Good morning. Good morning. It is early. It's cold.
Yeah.
My name's Jason Kraig. I am the director of community health for Valley Health System. So I get the pleasure of representing all 6 of our hospitals in the communities that they serve. So primary responsibility becomes the community health needs assessment. It's kind of our roadmap.
Yeah.
As we kind of interact with our community every 3 years, we update that to try to figure out, what are some of the priorities that are on people's minds, and trying to figure out ways that we can continue to extend our mission through partners like you guys.
Yeah.
Yeah.
And what geographic region does the community health needs assessment cover?
That's a good question. So we have primary and secondary service areas through the hospital. And so Winchester Medical Center is our flagship hospital. So, if you look at the Eastern Panhandle, kind of Eastern West Virginia, as well as the entire Shenandoah Valley, that's kind of what we assess. But the primary service area around each hospital would be the ones we have to do one for every hospital. So we'll do 6 reports. From those reports, there'll be implementation plans that we will actually work with our hospital leaders and our community leaders to try to figure out ways to address some of those needs.
I love that. And one of the things that comes out of that is you come back, like you said, you come back and you are able to implement some things. How do you guys measure the success of the implementation of those? And maybe it depends on what exactly is implemented, but can you give us an example of, a need that was identified through this, what you guys did and what the outcomes were?
Yeah. I mean, if you think about it, our current, I guess it would be current, so 2022 Community Health Needs Assessment identified mental health and substance use as one of our priority needs, and the health system has really made an active. We've been very active in investing in that area. So, as a health system, we just opened up our empath unit, which is that
was going to be my next question, was to tell us more about that.
So the empath unit, which is great. It's it's a voluntary, involuntary space where people can actually, if they're in need, if they're in crisis, go and get help. Like you can knock on the door and be like, "Hey, I need help," which is good. It was, one of the first in the state, and I think that's a direct kind of reflection of needs being identified and actions being done. We're in the process of continuing to build out behavioral health services to really put a large outpatient mental health facility that will support. Crisis is one thing, and it's usually the squeaky wheel, but it takes a while to get into crisis sometimes. And if people had those services prior to that crisis, maybe they could have avoided it. So we find it's important to have those additional outpatient services to prevent and or to help people recover from. If they have a serious event, or if they have something that really affects them and they need that continued support to keep them out of going back into crisis, we'll have hopefully both sides of it.
Yeah. You are also a part of the community health impact grants and that process.
Yeah.
So tell us a little bit about that and why that's important to Valley Health.
Yeah, that went, so the application process just went live on the 15th of January. And so our community health, so we have two buckets, I guess you would say. From the community health needs assessment, we have mission critical partners like yourself. So these are organizations in the community that we financially invest in order to extend their mission. We know that places like Sinclair Health Clinic, those free clinics are organizations that we need in our community, and they're mission critical for us to take care of populations that are special to them. And then we have community health impact partners. So annually, every year, we go through this process of establishing priorities and asking organizations to help us to extend our mission, whether that be for social determinants or addressing chronic disease or whatever the case may be. People come with with projects or ideas or ways that they can continue to support us in addressing those needs. I think a good example of that was what Goodwill's doing in partnership with Sinclair and Department of Health and Department of Social Services and CCAP and having that mobile effort to reach people as they may be in need. But we've had things like, literacy volunteers did a health literacy curriculum, and that's just really educating and navigating the system. The community, the healthcare system, which is all super complicated. So it's really been really great to see what the community response has been to some of those needs.
Yeah. You mentioned social determinants of health. You and I are very familiar with that. Can you familiarize people who are watching who might not be familiar with that, what social determinants of health are and how that plays a role in what you and I do?
Absolutely. I think probably some of the major ones would be housing instability. So a world near and dear to your heart. So housing instability is one of them. Food insecurity would be one of those. Transportation issues, utility concerns, interpersonal safety, how you experience your built environment. So, those are all things that really affect the long-term health outcomes of an individual.
Yeah.
If somebody is sick in the community, or if somebody's transitioning out of the hospital and they don't have a place to safely heal, to get a healthy meal, their outcomes are worse. And that's what the research tells us. And that's, I mean, in many cases, common sense to many of us. If you don't have, a safe place, it makes it hard. It makes it hard for people, for sure.
Yeah, it definitely does, and I love how you guys are very holistic in that approach. I think frequently people can look at the hospital system and look at you guys just as emergency and just as healthcare provider, but it's so much broader than that. It is public health, which covers housing, it covers emergency care, it covers care from birth to from conception to death, and care all the way through that, and then
the headspace in between, because I know mental health is something that is something that you see here, but also something that we see within the community, and as a a current concern and likely an ongoing concern. I think supporting people in achieving not only physical health but mental health, will help contribute to their length of life or their physical well-being or their quality of life. And I think that's all super important. Yeah.
You've been in this field not for how long?
Oh, geez. I'm going to date myself.
And there's a reason for this. There's a reason for this question, because I think I've seen, and I've worked, here at the Rescue Mission for about 7 years, and I've seen the conversations around mental health and physical health care and kind of how those two are correlated, but also different. I was going, asking, how have you seen that shift in the conversation? Do you think that that's progressing in a positive way?
Yes, I do. And I don't know if you know this. I've been in healthcare for almost 7 years. I think when I first joined, it was operationally based. Was in the urgent care world. And after the pandemic response, we realized that we can do a lot with our community if we do it with our community, and respond to big problems with good friends. And that's my experience in healthcare was, really operationally supporting, care within our community, but then it transitioned quickly into relationships, partnerships, and trying to solve big problems. But I think my experiences prior to healthcare have helped in that. I started in behavioral health. I started in behavioral health and then transitioned to social services. So, I did a few years of in the streets, on the home, in the homes, investigating child abuse, which gives you a different perspective on life. And then from there, transitioned to public education. And then from there, transitioned to private education. And from there, transitioned back into behavioral health before entering into healthcare. So I think being able to look at a lens through different shades of community allows for different conversations, different perspectives, and that kind of that holistic approach to understand that people's mental health, people's education, people's social situation all plays into health.
Yeah, I agree, and we see that every day. And I think it's when you think about it and talk through it, it's kind of common sense. But I think a lot of times people look at a certain situation and they just see that current situation for face value, but they don't actually try to understand the things that contributed to that. You mentioned childhood trauma, and one of the things that we look at is ACEs, adverse childhood experiences.
Absolutely.
And I don't know if you're necessarily an expert in it, but can you go a little bit into explain what ACEs is? Because I feel like that's a...
Yeah, so it's like a score of trauma. I mean, I guess simply stating is that, if your ACEs score kind of highlights the amount of adverse childhood experiences that you've had in your life, with an understanding that those traumatic experiences will impact you in your life, and not necessarily a detriment. It's not something that, like, if you had a bunch of them, I have a high ACEs score, and I feel like I've really focused on resiliency and overcoming some of the challenges that I've had within my own life to continue to progress and support others. But I really think it comes down to kind of that trauma-informed approach. Really understanding that trauma impacts the development of individuals. It really has, a behavioral component that impacts how people react to certain situations, and the quicker that you can recognize that they've had those experiences and those experienced those things and the impact that it can have, then you can support them better. And I think that's the important part, is really ACEs provide you information so that you can be more trauma informed, so you can support people as they develop and go down that journey on the way to resiliency and continuing to progress in their own lives.
Yeah, we learned a good bit. So our staff is trained through trauma-informed care because of a partnership with Shenandoah University, and one of their occupational therapy professors comes in and leads us on trauma-informed care.
Talks a lot. On that.
Oh yeah, yeah. So you are, yeah. So, and then you also mentioned some other organizations that you guys work with. Rattle off a couple of those organizations and the way that they also play a role in serving this demographic of individuals, such a vulnerable population, people experiencing homelessness and poverty.
Yeah. I mean, I think if you think about individuals that are experiencing something like homelessness, obviously you guys are a huge component for our community, but then it's a lot, right? I was talking to somebody the other day in Richmond, and we were like, it's a lot.
Yeah.
And it's simple to say it's a lot, but it's a lot.
Yeah.
Partners like Watts, that you work closely with Robin. And so, they provide a service that's different from yours, but also supports a similar population. Our local continuum of care, and now Horizon Goodwill has entered into that mix to do some of the street outreach. And so, we do our fair share, kind of try to figure out ways to support and our unhoused population or individuals experiencing homelessness. So you have those partners, but, without, some of those other things that promote social mobility, really, getting somebody mentally well, providing some of the workforce training that might give them the next job that they might get. I know that we talked recently about, trying to think of creative programmings where we can, kind of look at what you're doing on your workforce side to support individuals getting into employment opportunities, potentially at the hospital. So I think as you look at kind of social mobility and understanding, like, yes, ACEs scores, yes, current housing situation, yes, mental wellness, yes, physical wellness, how do we get all those things in line so that we can start to lift those individuals up so that they can start to progress through our community. And so you're going to have your Sinclairs that are going to be, your medical provider that's going to be, support for some of these individuals that maybe haven't been to a doctor in years. Haven't gotten their wellness checks, haven't gotten their vaccinations, haven't gotten their preventative screenings that, that we know help individuals stay well. Lab work to understand if there's medications that are necessary. And I know that, that those connections have been important, for us, but also hopefully for you, for people that you guys serve as well.
Yeah, 100%. What is one thing that you're currently really excited about in your role? Like, what is something you're working on that brings you a lot of life that you were like, I am so excited to see this happen?
I think, our assessment's going on right now. So www.valleyhealthlink.com/survey. So you can get on and do the survey. I'm excited to work with the Department of Health this time, in the way that we're working with them, because I think if you have your health system and your health department really buying into the needs that are identified, then that's exciting to me. I think, when we're bringing community together, but these are two health focused organizations that, bring with them the fact that they are the health department in the health system, and being able to work collaboratively with Tara and her team to do the assessment, to come up with ways that we can come together and support the community organizations that are serving in the community. I think that's really exciting. And I get excited about the planning. So the assessment is like, we've gotten over 2,500 responses. We've done, a dozen or so, you get to do interview sessions where you get to really have a conversation with people. You start to see some of those trends coming out, which is great. But then getting to that next step of what are we going to do to really drive some of the things that might involve, healthy eating or increased access to physical activities or, access to mental health care or, how do we support our aging population?
Yep, that's a big thing we've talked about.
That's one, not to give you a little sneak peek, but that is one thing that's starting to come up is, we have an aging population within our community. And I think you're probably seeing it here too.
Yeah, we have seen that shift.
Yeah, a little shift in how do we continue to support individuals that are aging in our community that have more and more complex needs, both physically, mentally, and socially.
Yeah, we've seen a couple of shifts in, I think, our services in kind of residential programs. We've seen kind of an uptick in our aging population. Don't break my equipment.
I know, jeez. Causing a ruckus.
We've seen kind of a shift in individuals who really young adults who've aged out of kind of social services. We've seen a shift in that, and then particularly in a food ministry, we've seen a big shift in individuals in the refugee population coming to us in need of groceries, in need of food, non-English speaking, and so needing to use some translation services on our phone. Thank goodness for technology, because they're coming to us in need of food, and so we've seen a kind of shift in the demographic of that, and in food ministry. Seen more families come to us. And I think that's kind of the pinch that a lot of us are feeling with the cost of living increasing. Andrea from CCAP was here yesterday. They're kind of like a homeless prevention program. So trying to stop people from or provide people resources that can stop them from truly ending up.
It takes how long? You always say that one.
Yeah, on average, it takes approximately 6 years for somebody to experience chronic homelessness.
Got it.
And so for programs like ours across the U.S., on average, that looks like anywhere from 12 to 18 months of a really in-depth program, and things like that.
I think excited for some of the stuff you guys get going on.
Yeah, really excited. We've done a little bit of talking about that, our
Yeah,
expansion
yeah.
into Valley
Okay.
Avenue. And
I'm sure you had, so I was like,
yeah.
I'm excited for you.
Yeah.
We don't have to, we don't
Yeah.
have to talk about all the details because I'm sure you have. But,
Yeah. Talked about that as it relates kind of to you guys. There's a room specifically set aside just for mental health and physical health care providers, and I think we are, because the location, we've got a larger parking lot, we've got just a larger facility overall, and so I think some of the creative things that we've seen other community partners do in regards to like mobile health care, because we've explored telehealth. Telehealth has been a big thing during COVID, post-COVID, trying to kind of tinker with some things and figure out what might work, trying to remove some of those barriers that such a vulnerable population has. Continuing to try telehealth, but then maybe mobile health is I think something that we're going to explore, and having an actual physical office space dedicated just for things like that. So yeah, really, really excited about that.
Mobile, I think, is an opportunity, especially, Winchester proper, has better access than some of our outside rural communities.
Mm-hmm.
And you probably see that as people come here for
Mm-hmm.
services and support. But, mobile is something that we recognize that as you get farther into the valley and off of 81 or off of Route 11 or, into some of, the more remote communities that mobile may be an answer to, to support people, going to places of community, going to places of faith, going to places of education, going to places of employment, to bring care to people so that they, so that they don't have to take a day off of work. That they, don't have, transportation barriers or any of the other barriers that that might be in place as they're trying to achieve their wellness journey.
Yeah. Well, I could geek out on all of this with you and like just take up all your day. Are you working today, or are you just showing up just for this?
I'm showing up for this.
Yeah, okay.
And then I'm going to the housing summit, the planning meeting. So,
awesome. Awesome. Well, good.
We'll work with Kim and the other folks in the community that are coming together to
I'll make that happen.
Yeah, to talk about housing and what that looks like for our community and talk about that continuum of housing that we always are challenged with as our population grows on it seems like daily basis.
Yeah, definitely a growing challenge. Well, thank you for coming by. I appreciate it, sir. Appreciate all the work that you do.